Hi, so today I'm going to be talking to you about Tetralogy of Fallot, which is a heart defect that your child has. So what that means is it's a combination of 4 different defects. Ventricular septal defect, which is going to be a hole at the top of the heart in between the bottom 2 chambers. An enlarged aortic artery, so that's the artery that goes to the rest of your body, and that's going to be bigger because your heart's working a lot harder. A narrowing of the pulmonary valve, which is what takes blood back and forth to the lungs, and also an enlargement of the bottom right half of your heart. That bottom right half of your heart is what pumps blood through those arteries. So it's working really hard to get that blood flowing. Because your heart's working so hard, what you're going to see in the child is cyanosis. So what this means is that your baby might be turning blue because they're not getting enough oxygen. The doctor will also notice a loud murmur in the heart when they're listening. So what this can mean is that your baby can suffer from TET spells. What that is when their oxygen gets really low and they start breathing really hard and they get really tired. If they're old enough, you're gonna see them crouch down to their knees. And this brings their knees to their chest, which helps them increase their oxygen levels. If your child isn't old enough, if they're an infant, you might need to be doing this for them. If you start noticing them turning blue or not being able to breathe as well, you want to bring those knees to the chest so you can increase their oxygen level. If they suspect that your child has this, they are going to order an echocardiography. So what this does is it looks at the size of the heart, sees what part of the heart is affected, if it is indeed this condition, and then they might do a cardiac catheterization. So that is the procedure where they're going to send a wire up through the child's artery near their leg, and it's going to go to the heart, and that can examine the size of the arteries. Sometimes it can be used to close holes or open the valves. Like we said that it's going to get really narrow, it can be used to open that valve. Some treatment they might do is prostaglandins. So what these do is that they keep those ducts open until the patient can go for surgery. So that shunting of blood is what's actually helping the patient have oxygen right now. So we don't want that to close until we can get them to surgery. Until we can get them, some of the roles as me as your child's nurse is going to be also correcting those TET spells. So in addition to the knee to chest position, we need to make sure your child stays very calm because anxiety can increase that heart rate, which increases the workload of that heart. I also am going to give them oxygen because since they're so low in oxygen, they're going to need some more to deliver to the rest of their body. Okay, do you have any questions for me?